Welcome, everyone. We're starting to let participants in, so that's great to see you flowing in. We're so happy that you're here with us. While you're entering, if you want to go ahead and put where you're from in the chat box, that would be great. We have people from lots and lots of places across the states and in some other places. So welcome to you. We're going to be talking about a subject that I don't think a lot of us hear a lot about, which is extreme heat today. And we have some fabulous speakers who are going to tell you about the implications of extreme heat for pregnant people and for very young children. And we're so glad that you are here. I am going to give folks a few minutes to filter in and to come into the room. And thank you. We've got folks from Maryland and Ohio and Pennsylvania and Minnesota and Grand Rapids, Michigan, and Oklahoma City. I was born in Oklahoma City, Oklahoma. So hello, welcome to you. So let's see. Yeah, I'm going to give a few more seconds and then we'll go ahead and get started. Welcome, welcome, everyone. Okay, Jonathan, let's go ahead and move to the next slide. So welcome once again, everyone, to our fourth webinar in the Whole Child, Whole Family, Whole Systems webinar series, entitled When It's Too Hot to Play, Sleep, or Learn, Supporting Children and Caregivers in a Warming World. I am Michelle Adkins. I am the director of the Prenatal to 3 Capacity Building Hub, which is a project of the BUILD Initiative and is funded by the Pritzker Children's Initiative. My co-host today is Ngazi. Ngazi, you want to introduce yourself?
Hi, everyone. I'm Ngazi Lawal, and I'm a consultant at the BUILD Initiative, and I'm really happy to be here with everyone. Back to you, Michelle.
Thank you. Next slide. So before we go any further, we want to allow our interpreter, Alonso, to give you some instructions about how you access the Spanish interpretation for the webinar. So Alonso, take it away.
Thank you, Michelle. Good afternoon. Buenas tardes. My name is Alonso. I'm here with the Community Language Cooperative, providing simultaneous confidential first-person interpretation for today's meeting. As part of a collective effort to help create a space for language justice during this meeting, so participants can communicate and engage in the language of their heart. A quick reminder to do your best to be clear, concise, and as succinct as possible to allow for the best interpretation considering the depth of our topic today. In a moment, you will see a globe at the bottom of your screen where you can select the language of your heart or your preference. Or if you're joining from a phone or a tablet, you can select the 3 dots to activate this function. If you are not bilingual, you can select your language of choice and also silence the original audio so that you don't hear both languages at the same time. Buenas tardes, mi nombre es Alonso y estoy aquí con la Cooperativa de Lenguaje Comunitaria, ofreciendo interpretación simultánea, confidencial y en primera persona para la reunión de esta tarde, como parte de un esfuerzo de practicar la justicia del lenguaje. De esta forma, las personas y los participantes puedan participar en el idioma de su corazón. Les recordamos intentar ser lo más claros y concisos posibles para posibilitar la mejor interpretación. En un momento, usted verá un icono de globo abajo en la pantalla que dice interpretación. O si se está conectando a través de un teléfono o tableta, verá 3 puntos en la pantalla y aquí es donde usted podrá pulsar y activar la interpretación escogiendo el idioma de su preferencia. Si usted no es completamente bilingüe, puede seleccionar su idioma preferido y apagar el audio original para que no escuche ambos idiomas al mismo tiempo. Muchísimas gracias. We can activate interpretation now. Thank you.
So everyone make sure that you have selected the language of your heart so that you can hear the webinar in the language that you choose. And I think Ngazi now is going to talk a little bit about both the objectives for the webinar series and for our specific webinar today.
Yes, thank you, Michelle. So if you've been with us before, you'll know that we are in the middle of the Whole Child, Whole Family, Whole Systems webinar series. And the objectives that you see in front of you are the themes that we have been covering. If you're joining us for the first time, welcome. Here are some of the topics. So we've been talking together about a whole system approach, an approach that will help us center the child and family, help us think about what are the challenges that are keeping us from successfully serving children and families in a whole family kind of way. We have been having conversations about ways to bring systems together so that services are seamless for families. We've been centering family voice. So we have been beginning our conversations with real families, real parents or caregivers that have a real perspective on the issue. And that's really important to us. And we will be doing that today. Really excited to introduce our parent in just a few minutes. We also think about ways that we can leverage leadership at all levels, and how we can leverage data to help improve the work that we're doing. And we are learning from real world examples. We are thinking really broadly around, who we're inviting to the table, so that we're not hearing from the same voices, and thinking about ways to make what we're discussing and learning about actionable, so that when you go back to your work, you're thinking about new, fresh ways to take action. And we are finally, but not least, thinking about how to sustain these conversations and to keep the work going, whether it's conversations that you're having with your colleagues, or we're thinking about sustainability from a financial standpoint. Next slide, please. So today's objectives, as Michelle pointed out, we don't often talk about extreme heat, and I won't read all of these objectives. You're going to hear from our presenters today, who will talk about the different ways that they have been thinking about this topic and also have been addressing the issue. So you will hear from a parent and how she came to learn about extreme heat. You will also hear a scientific perspective and what we're learning about brain development. You'll also hear some perspectives around some new tools and ways of thinking about how to keep children cool and healthy and safe. And we'll do a spotlight on Boston, Massachusetts, and some of the really important ways that they have been advancing this issue. Next slide, please. And so with that, I will go ahead and introduce our presenters. So we're thrilled to begin with Samantha Topolsky. She goes by Sam. So Sam is a parent partner at the East Boston Social Center's Family Engagement Network. And as a mother of two and a deeply involved community leader in East Boston, Sam brings the critical perspective of a parent and local advocate navigating the real-time impacts of climate change on children and her families. Her leadership across multiple community perspectives, including Boston Saves and the Mary Ellen Welch Greenway, makes her a vital voice in understanding how families are adapting on the ground. Next, we will be joined by Dr. Lindsey Burghardt, the Chief Science Officer at the Center on the Developing Child at Harvard University. Dr. Burghardt leads the center's scientific agenda and is the founding director of the Early Childhood Scientific Council on Equity and the Environment. She brings a research-based understanding of how our built and natural environments directly influence children's development and lifelong health, and how we can use this science to inform action. After Dr. Burghardt, we'll hear from Dr. Kelly Turner. She's an associate professor of urban planning and geography at UCLA. and Associate Director of the Luskin Center for Innovation. Dr. Turner leads national research efforts focused on heat resilience, including directing the Center for Heat Resilient Communities, a NIHHIS Center of Excellence. Her expertise in heat governance, planning, and actionable policy data gives us an essential systems-level view of how to equitably protect communities, especially vulnerable children, from the growing risks of extreme heat. And her work has been widely published and funded by major institutions. And then finally, we are honored to welcome Kristin McSwain, who's the director of the Office of Early Childhood for the City of Boston and senior advisor to Boston's Mayor, Mayor Wu. Kristin brings decades of experience of advancing equity for children and families, having previously led the Boston Opportunity Agenda and held senior leadership roles at the Corporation for National and Community Service. Today, she leads Boston's Children's Council and is at the forefront of designing innovative cross-sector strategies to support young children and caregivers in a changing climate. So as you'll see, each of these presenters bring a vital lens to this conversation, helping us build a more responsive and resilient future for children and caregivers in a warming world. So I will now turn it back over to Michelle.
Thanks, Ngazi. So we always like to tell people a little bit about who's in the room. And today we're pleased to say we have over 500 registrants for our webinar today. We've got 45 states represented, plus the District of Columbia, Puerto Rico, and the US Virgin Islands. You're from state agencies, you're from child and family serving organizations and nonprofits, you're from early childhood coalitions and center-based and home-based childcare, and childcare resources and referral agencies, colleges, universities, foundations, and hospitals and healthcare providers. We've got lots of people on the line. I'm excited to share this information about extreme heat with all of you. So next slide. So who are all you people? We've got, again, a breadth of folks who are on the line. We've got early care and education specialists, preschool application specialists, we have clinicians, we have infant mental health training specialists, we have professors, we have program specialists, we have family friend and neighbor educator facilitators, we have program managers, we have federal project officers, supervisors. Lots and lots of people are with us today, and we're very happy that you have decided to give us some of your time to learn with us today. So I think that we're going to do one more thing quickly before we get into the content. So I don't know if you guys are familiar with the chat waterfall. So here's, we're going to ask a question, which is on the slide. And then we would ask you to put your answer in the chat, but don't hit enter yet, so that everybody has a chance to put their response to the question in the chat, and then we'll all hit enter all at the same time, and we will get a waterfall of answers. So the question is, using one or two words, describe how you coped on extremely hot days when you were a child, either at home, at school, or simply outside. So everybody type your answers in the chat and don't hit enter quite yet. So I'm going to give you just a couple of minutes, couple of seconds to think about how you did keep cool on those very, very hot days. And I think you've had enough time. So let's all hit enter. And here we go. Here's all the answers. The pool, popsicles, read books. I presume that was inside reading books. The pool, play at the harbor. Oh, that sounds nice. Playing with the water hose. I stayed under a tree in our backyard. That's a beautiful thing. We're going to talk about trees later in the webinar. I went to the movies, or I went to the river. to the beach. I sat in front of a fan, indeed. So we all had our own strategies of trying to keep cool when we were little. And we're also going to start talking about how providers and how cities in the city of Boston are trying to make those kinds of cooling mechanisms available to specifically to pregnant people and very young children. So I am now thrilled to be able to invite Sam and Ngazi to the screen and have them have a conversation about Sam's experience dealing with extreme heat. Sam, Ngazi?
All right. Thank you, Michelle. And Sam, thanks so much again for being with us. You are a parent partner at the organization that I just introduced, but most importantly, you're a mom. And so you're a mom of 2 kids living in Boston. And, when people think about Boston, they usually think, a city with people that's got like lots of snowy winters. They're not normally thinking extreme heat. But as you experienced, you shared with the build team that Boston summers now bring real heat challenges. So my first question to you is, how did you first realize that your son was being impacted by the heat?
Hi, thank you so much for having me here. Yeah, so when I first realized it, because like you said, Boston is always everybody known as a cold city, so we really doesn't learn much about heat impact on the young children. You learn as you go. So my son, he is when he was a baby, his stroller and his crib or his car seat is always like steamy hot. And then so he's easily to, when he was a little, he has a speech delay, so he doesn't really express his discomfort until older. So we didn't think of much. He will be having rashes on his back. He will be refusing, kind of putting him back to the stroller is hard, and he kind of refuses it. And he's hard to fall asleep when you because, again, it's really hot. And when you pick him up, you can see the sweat. And as he gets older, he's able to express himself. He starts saying he has headache, or he starts saying, like his discomfort. So then you kind of starting to, wondering, it's just summer. It's just a hot day. So we didn't think of much. But at the same time, we kind of need to start looking for something. We don't get much information here. Like, I'm from Taiwan, and Taiwan is a very hot country. And so I learned something from my friend back in the country. Oh, they use the breathable cooling pad underneath the crib, and you use the breathable pad for the stroller. And then these are the information that I wish I was known like way before they were a baby, because even like a baby, they cannot regulate their body heat. I didn't learn this until I really joined the extreme heat discussion.
I appreciate that, Sam. And I can see how you and your husband could easily think, if your child is experiencing discomfort, to just chalk it off to, oh, it's a hot day. It's just a hot day, right?
Yes.
Like, if you experience summers, you know what a hot day feels like. And if a child is showing discomfort, you could easily just dismiss it as it's just a hot day. But later, with advice from your friends and just learning, because that's what we do as parents, we learn
Yes.
along the way. You learned about his heat sensitivity and how extreme heat can be for young kids. So now that you have this awareness, can you tell us what efforts you make now to keep your children safe and comfortable during the heat wave? Like, do you plan your day differently now? What are some real specific things that you do?
Yes, I do have to. I do plan my days differently, because when they were little, I didn't drive. So actually, they're in the stroller for a long time. I can see now. I can think, oh, I wouldn't want to be in the stroller that long, because I have to, go to the train and walking at least 15 minutes to get to the train station, and then walking longer after train to get to the park, get to the museum, get to other places. So I will, leave early, super early, or I leave later in the afternoon. So kind of avoid the UV peak time. And my son, he is fairly white, so he gets sunburns as well. So we need to plan how much time we're going to be in the sun, and we need to find a place that has more shades, and we need to make sure we have a lot of water to keep them dehydrated. Yes.
Thank you for that. So it sounds like you're thinking a lot about what you do now to
Yes.
keep them safe and cool. I want to go back to the symptoms that you saw that you talked about, because I can easily see how a child is sweating and a caregiver thinks exactly what you and your husband thought. Oh, it's just a hot day. Could you just go a little bit deeper and tell us more about the symptoms? So, you shared that, he was sweating a lot.
Yes.
You mentioned that when he did become verbal, he talked about having headaches, that he was dehydrated. Are there any other symptoms that you observed that helped you to realize that this is something a little more serious? It's more than he's just feeling hot.
Yeah, so I notice every time when he come from outside, when he come back, he's always complain he has headache. And you can feel like the heat coming out of his head, like without even touching him. So, and then he gets he's not as focused, and he's very distracted, and it just gets fuzzy easily. And so the impacts, like at the beginning, we give him the Tylenol before bed, but as the frequencies of headaches, it's not sustainable. So we stop doing that, and then we have to improvise, put a towel in the fridge, and then kind of cool him down. And like all these tips, I wish someone can put it together and then make it information and send it to everybody, and because it does help my son a lot. And or putting the cool towels under the pillow, and not on the pillow, so kind of like reduce his body heat. That helps, because I cannot keep giving him Tylenol every night. Yes.
And I'm really glad that you're able to explain those symptoms that you saw. And I just want to laser right in on the behavioral ones that you
Yes.
talked about, because I don't think most people would make the connection between being affected by heat and then being unfocused or being distracted or having behavioral changes. And when I think about children in the birth to 3 age range who don't have the full use of their vocabulary, I can easily see how children can be affected, but not able to quite communicate how they're feeling or what may be happening with their body. All right, so I appreciate that. The last question I wanted to ask you is that you've been a parent partner on Boston's Extreme Heat Roundtable, which will be discussed a little bit more in the presentation. Can you talk about one thing that you would want policymakers, city leaders, people who are in decision-making roles to remember about how they might help support families like yours?
Yes, for this part, actually, I have 3 parts actually. And
Go for it.
so I really, really encourage every city that you can have a focus group and really listen to the families, because every area is different. Like so you can really understand like what the local families needs, and really like a workshop for family to raise the awareness to how much impact of extreme heat on young children. Like I wish I knew when I just had a baby, how to comfort them, how to help them, that they cannot communicate, they cannot say. And also understand the local resources that you have in your area, like sign up for the city alerts. And these are the things, and also find out where are the cooling centers, and also for for the policymaker, like I can see like outdoor, how to expanding the locations of the cooling centers, like at schools, libraries, parks, community centers, and nonprofit organizations, anything that you can think of. Everybody should come together as a whole to really help all the families for easy access to a lot of places to make it easier. And then work with the pediatrician. I really, really think is so important to have the pediatricians and school to understand how important this is, and then give the family the information and resources. And also like providing, let's say it's really hard, it's dangerous to go outside. A lot of people, they say, oh, then you just stay home. But the one challenge is not every families naturally know how to be indoor with their children. And a lot of family choose, I'm going to take my kids out so they can play the park, they can do this, they have things to do, but when they're inside, they don't know how to do it. But how do we help them? That doesn't mean we're bad parents. That doesn't mean we don't love them enough. It just means we need more support. We need more assistance to help us, how to, inside the house, we can still have quality time, even it's really, really hot. We cannot go anywhere. I think that's really, really important.
Thank you so much, Sam. And I just love that you really painted a clear picture. That last example that you just gave was just really illuminating. Like if there were to be, an alert that it's really hot, people should stay indoors. Well, families can do that, but can you provide some supports and resources to help show families what that looks like and how they can do that in a safe and enjoyable way, because it is not intuitive on how to make a positive learning experience for children when you have to be indoors because of the heat. And then you also said another thing that's really important. Well, you said many things, but you also talked about bringing families together and listening to them. That is a really important next step. So thank you so much for these insights. And then you also talked about the importance of involving pediatricians and medical providers, because these are professionals that families interface with a lot. And so that's a perfect segue for us to turn to Dr. Lindsey Burghardt to share some of the developmental science with us. So Dr. Burghardt, please take it away.
Thank you. Let me take a minute to share my slides. It's always very nice to be on a talk with Sam. I always learn so much from her. All right, how's that look to everybody?
Great, thank you.
All right. So I'm going to take a chance to talk today about how extreme heat affects early childhood development and health. Now, there's specific times during development when biological systems are really especially sensitive to environments, and the prenatal period and early childhood are two of these times. And many of us here today and many people in the field for a number of years have recognized this really central and core importance of the child-caregiver relationship in terms of setting the trajectory for lifelong health and well-being in childhood and beyond. And these relationships are still really, really important, but they're not happening in isolation. We heard from Sam really how much the environments that are surrounding caregivers actually influence our ability to be caregivers and to have those foundational central relationships. So it's not only the caregiving environment that influences development, but it's the built environment. So what's the quality of the housing where children are living, or the reliability of the transportation that their caregivers are using to get around their neighborhood? And what's the quality and the temperature of the air that's surrounding them in their natural environment? These things also really importantly affect what developing biological systems are exposed to, and so they shape development in that way. And then beyond that, systemic forces like climate change and structural racism come in and shape the way that children experience their neighborhoods, and therefore the way that these exposures are experienced during development. And so when it comes to thinking about climate change, there's two really important categories that we can think about. So the first one are direct effects. And we're talking about extreme heat today, but I saw in the chat someone mentioned extreme cold. We can think about wildfire smoke. We can think about air quality. There's water, a number of other climate-related effects that also have these two categories of development of effects. And so when we think about direct effects, children, just like adults, can be affected by heat stress and heat stroke, and actually their small bodies heat up more quickly than adults, so they're even more sensitive. More children developing asthma or allergies because of this extreme heat. So those are direct effects on their biology. But then there's also a really important category of indirect effects. And these are a group of effects on children that I think we really need to start to understand a lot more and to talk about a lot more, because the solution space just really opens up when we think about all the cascading ways that even heat in particular affects development. So for example, if your caregiver has heat stress or heat stroke, they won't be able to go to their job and provide for your basic needs as a child. Or if your school is so hot that you can't go out on the playground and play, and we'll hear about this from Dr. Turner in a bit, and there's no shade, how does that affect your ability to learn and play and interact with your peers and have that social connection? So these things all have cascading effects on development that are really important to understand. And for purposes of today's talk, when we're talking about extreme heat, we're really talking about when temperatures are significantly higher than normal for a given location. And this is really important because it means that places like New England, the Great Plains, the Pacific Northwest, areas that maybe aren't traditionally thought of as very hot are going to be affected by heat, and the children there will be affected just as much as places that are traditionally thought of as having warmer climates. Now, the good news is that there's practical, actionable solutions that exist that cities, we'll hear about Boston in a little bit, and many communities are already implementing to good effect. And the good thing to know about child development is that even though children are more sensitive to heat, and that means that these negative exposures can really have profound negative effects on them, the flip side of that coin is also true. So anything that we do to protect people during pregnancy, during early childhood from the effects of extreme heat are also going to have this really outsized positive effect on all the outcomes that we care about as well. Now, heat has a number of effects during pregnancy and early childhood, and these are the four big categories that we're going to touch on lightly today. The first one is fetal development, and heat can have a really important effect not only on the person who's pregnant, but also on the fetus. Now, there's increasing and strong evidence that particularly after heat waves and in the later parts of pregnancy, that high temperatures lead to more babies being born too early or premature, which we think of as births happening before about 38 weeks of gestation. Now, prematurity is a really, really important outcome to think about, because not only does it carry a heightened risk of dying in the newborn period or of being readmitted to the hospital, but preterm or premature babies also have more trouble with feeding and growth, and they have more problems with jaundice. And then not only in the moment of the newborn period, but throughout their lifetime, preterm babies have more struggles with impaired cognition and learning. They can have reduced growth, challenges with their growth, and then a heightened risk of things like cardiovascular disease and diabetes in adulthood. And this is really, really important to think about, because if you take an outcome like preterm birth that already affects somewhere between 10% to 13% of babies in the US, and extreme heat comes in and increases those numbers even just a little bit, that can have a really profound impact, not only in the moment when those babies are all admitted, or not all, but have a higher risk of being admitted to the NICU, but also throughout their lifetime when they hit the school system with the challenges with learning, and then when they reach the adult medical care system, when they can have a heightened risk of these other complications. Excessive heat can have a really important contribution to learning loss, particularly in our more northern climates that may not have the infrastructure for cooling. So heat's linked to a slower cognitive function and a reduced concentration ability. And we know that the optimal temperature for learning is much cooler than what many of our schools are experiencing in September or even in October in the past few years. Now, the good news is that we know that cooling classrooms, so taking a classroom air temperature from 86 degrees Fahrenheit air temperature to 68 degrees can have a profound effect, up to 20% improvement on student performance on school-related tasks. There's also this really important contribution of if you're missing school because your asthma is flaring, that has a really significant contribution to learning loss as well, especially if your asthma is flaring on multiple occasions over several heat waves over time. Now, sleep is such an important topic because getting good quality sleep is so essential for all of us, but it's especially essential for healthy growth and development. And a lot of us are familiar with that need for a dark room when we sleep to help us fall asleep. But actually, there's a really important drop in our core temperature that happens that also helps us to fall asleep. And so if the room is too hot where a baby or a child is sleeping and that core temperature can't drop, that actually will also impair a child's ability to fall asleep. And there's studies of this looking at infants in the UK during heat waves. They took longer to fall asleep and had more fragmented sleep. Those of us who care for infants overnight know that if infants are up more frequently overnight, so are their caregivers, which has a really profound ability for us to show up as present, reliable caregivers the next day. Now, it's important, but this is true for all of us, that in infancy and throughout our lifetimes, repeated and chronic disruptions in our sleep can have really important effects on our ability to learn, particularly in early childhood. This can disrupt children's language development, disrupt their cognitive problem-solving skills. It can also carry a heightened risk for a range of health-related effects across our lifetime. And finally, excessive heat has really important effects on our mental and behavioral health. Now, the brain actually detects heat as a threat to our well-being, and this activates our stress response system. This is really, really important early in life when those developing biological systems are so sensitive, because if the formation of our early brain circuits are disrupted by this stress activation, that actually affects the foundation for all of our mental health outcomes later in our lifetime. And additionally, excessive heat increases a rate of a number of different types of violence, both in the home and outside of the home. And this can also have a really important disruption because children are so sensitive during this time of development on their mental health across their lifetime. Now, we know that extreme heat doesn't act alone. It amplifies the effects of systemic inequities that we know exist in housing and in neighborhood and community infrastructure. So we can imagine if there's a neighborhood with a very high prevalence of concrete and a low prevalence of shade or tree canopy, children in that neighborhood will experience heat waves and very hot days very differently than children who might be in a neighborhood with a lower prevalence of concrete, and a higher prevalence of tree canopy or shade, where they can still go outside and play and their caregivers can still come outside and have that neighborhood social cohesion together. So we can think about, and we'll hear about, the harmful effects of heat being addressed on 3 different levels. First is protecting, taking immediate steps to make sure that pregnant people and children are protected from extreme heat days. I'm excited to hear from Dr. Turner about how we can adapt our services. How do we think about our school infrastructure, our playground infrastructure, so that we're better positioned to withstand some of these effects? And then finally is prevention. So how do we all think about the root causes of why the planet is warming and thinking about how we can limit our burning of fossil fuels like coal and gas? And finally, really importantly, increasing our biodiversity is an important step in prevention. So this is the solution space that I think has a really significant range of benefits across multiple domains of children's development and health. So thank you so much for having me, and I really look forward to the rest of the conversation.
Thank you, Dr. Burghardt. We really appreciate those really powerful insights in helping us to just ground this conversation in both the science and the real world impact on children and families. You help us see what's at stake, both short-term and long-term. So let's keep the conversation going. We're now going to hear from Dr. Kelly Turner, who will talk about her research and also help us to see a city planning perspective. Dr. Turner?
Thank you so much. So it's always really helpful to hear from Lindsey and to have that background about how heat is impacting children's development and their physiology. And now I'm going to talk a little bit about our environments and how our environments are not currently supporting healthy development, but how they might be able to better in the future. So just a little bit, I work at a research center at UCLA. That does policy and planning work, environmental policy and planning work, and I lead our heat equity team. If you want to learn more about our research and products, you can follow the QR code. And then throughout my talk, I have QR codes posted so you can find the resources easily that I'm speaking about. So I focus on schools quite often. Why? Because schools are sometimes the hottest places in any given community. So here you're looking at a map of the neighborhood of Watts in Los Angeles, California. And there's this big red spot when you look at satellite imagery and the temperatures sensors available through that method. And that big red spot there, this is several years ago when we started auditing different neighborhoods. And we wondered, well, what could that be? And when we zoom in on Google Earth, well, that is a school. And specifically, it is that big down at the kind of bottom of the school, that concentration of asphalt and artificial turf that is making the play space really, really hot. And so this is a very typical design in California and in many places in the US. And schools, we say, are just hot by design. And that's problematic. Why? Because playing outside is so essential to children's health and well-being. But if it's too hot, they can get dehydration, headaches, heat stroke, and many other health impacts. So it's trying to find ways to support all the healthy benefits of being outside while preventing those negative impacts. And again, this matters because kids, even kids, the design of playgrounds and stuff that we're learning about schools is transferable to the context of children in all different play spaces. We've worked in playgrounds. We haven't worked in early childhood education centers, but it's a similar set of design principles that will be transferable here. And also similarly, that this is an equity issue. The school that I'm showing to you looks a little bit different than if I were showing you a school maybe in a wealthier neighborhood with higher tree canopy and other resources for design. So, what is the most effective thing that you can do to protect children outside? It is to provide shade. Shade is the best way to cool people outside. And so, if you want to hear a little bit more about that, you can follow this hyperlink or this QR code here. But I'm going to talk a little bit about some of the auditing work that we've done and what we've learned about shade in a school playground context. So shade is the most effective way to cool people. All else equal, you will feel 30 degrees Celsius cooler when you are in the shade than when you are in the sunlight. And that's using a metric called TMRT, which is a feels like. It takes into account the air temperature, the humidity, various factors. So it is the best way to measure feels like, the heat burden a person is feeling. So while putting things like grass and greening are fantastic for lots of reasons, they will not give you the cooling. Surfaces will never give you the cooling benefit that you get from blocking the sun. Blocking the sun is like preventative medicine. It cools surfaces below and it cools the body from direct sunlight, which is the primary way our body heats up. And what does that 30-degree temperature translate to in terms of daily life? Well, it makes the difference between safe and unsafe to be outside. So this is using adult metrics. We don't quite have this data ready for children, but children are more heat vulnerable. So we expect that the benefits would be similarly important. On a 90-degree day outside, with 30% humidity, hypothetically, a healthy adult might be able to safely walk in full sun and then jog in the shade. So it increases what you can do, how long you can do it, and how much space is available to do those activities, which has huge implications for quality of life. We've spent a lot of time going out into schools around Southern California and doing direct measurements. You're looking here at something called the Marty cart. It's a mobile biometeorology device. It measures all the various sources of heat exposure on the body. And then we map out what that feels like. And so looking at our data, we see on the top here all of the all the sun exposed surfaces, and at the bottom you see all the shaded surfaces. And it doesn't matter what surface you're looking at, the shaded surface is always way cooler than the sun exposed surfaces. And if we look at schools, we find that most of them qualify as what we might characterize as a shade desert. So shade deserts, it's not a particular amount of shade, but it's places that lack sufficient shade to keep people safe and healthy outdoors. And here we're looking at a particular school on the left side, what it looks like at noon, and then on the right side, what it looks like later on in the day. So only 5% shade at the hottest point in the day. Schools often are hotter than their surrounding neighborhoods. So here we're looking at a school in Watts and we're looking at the neighborhood around it. And what we find is that the schools are hotter on average than the neighborhoods that they are located in. So before, when I gave you that first slide, that was the surface temperature. This is that MRT, that heat burden on the body. But it's not really important to look necessarily just at the average, but you have to look very specifically at where shade is sited. So here you're looking at, again, another school site. And so if you see that box 4 there, that is a particular intervention site. 5 is standing directly under a tree. 3 is a whole schoolyard. 2 is the whole school. And on the right side, what you see is that if you go down to scale 5, standing under the tree, you get the most, that 30% bar. That's how much cooling effect you get. And you get less and less cooling effect. And when you get to the school or the whole modeled area, you basically get no cooling effect for an intervention. So design and placement of shade is going to be important because the impacts are immediate on the body. And so what we've been doing is thinking about, well, how can we design targets that are not just something like, let's add 30% shade to school. How can we make these targets more meaningful? Right? And one of the ideas that we're thinking about, and this comes from a report we did with the Trust for Public Land based on some interventions they did with Nike on schoolyards. And what we came up with was this idea of cooling efficiency. So this is, if you think of a playground and you think about 100% cooling being if you put a tarp over the whole area and you were able to reduce the temperature the maximum amount you could while still being outside and not air conditioned, what percent of cooling are you getting from the various interventions that you're putting into that space? And here we're showing that you can get immediately by planting trees. So that's this red line. You can get just a little bit, maybe like 5% cooling. But as the years go by, you can get about 30% of the maximum cooling as those canopies expand. And then you can see how much more you get by just increasing canopy a little bit. Another thing that we do at our center is we audit particular barriers that you might have, policy barriers to implementing shade. And so in California, for instance, well, there was a rule nationally that schools, according to the Americans with Disability Act, must have a matching requirement for any outdoor upgrades. So that means that if there's an upgrade for a climbing structure, that the school must match 50%. If they want to put a shade structure in, they must double that amount and do that matching for an ADA upgrade. Now, that's not inherently a bad thing, but it can be a barrier when schools are very finance constrained. So there have been a series of acts implemented in California to roll back our matching requirements. So federally, that requirement is somewhere around 20%. And in California, it was double, it was 40%. So trying to take that friction away. Another thing we've been doing at our center is we've been mapping shade nationally. So in the next couple of weeks, we're going to roll out the first ever national shade map at the census block group level for over 300 communities in the United States. And then we did a deep dive with a couple different communities to take a look at how shade might be implemented in different sorts of analyses and policies. And this is an example from Austin, Texas. They have a Safe Routes to School program, and they were interested in how heat safety factored into school routes. So with American Forests, our partner on this project, we designed an interactive data story and mapping tool. It's targeted at children so that they can go in, find their school, and they can try to map their route and see how shady it is. going to their school. And this is for every school in Austin. So a child can look at where they go, they can look at the sidewalks and see what would be the coolest route for them to take on their way to school. And then last but not least, I just wanted to point to the work that we've been doing in the policy area. Most of this has been focused on California. We also recently have been auditing school indoor cooling strategies across the US. So if you're interested in that, I can certainly point you in that direction as well. But that this is going to take both, some work at the school level, but also at the city and system-wide level, because a lot of the stuff that's happening at schools is because of entrenched systems that we need to take a second look at. So with that, I wanted to say thank you, and then just share a little bit here that schools cooling can be fun. This is a reflective paint mural that we did in Pacoima in the Valley here in California in collaboration with a group of youth artists. And just showing that this is reflective, so it's cooling the side of the building while it's also beautifying the school and elevating their artistic skills. So with that, I'll say thank you.
All right, thank you so much, Dr. Turner, for sharing those really actionable solutions and showing us what's possible when we thoughtfully design our environments for children's health and safety. And I even feel a little dangerous here because I have some new words in my vocabulary like tree canopy, TMRT, and Marty Cart, and all the really great ideas you shared with us today. So thank you, really illuminating. And now we're going to turn to Kristin McSwain from the city of Boston. Kristin, you are on mute.
Good afternoon. I was trying to get those slides up. So thank you all very much for having me here today. I feel like I've just followed some really great presentations, and there's lots of pressure for sharing equally important stuff. What I wanted to share was the story of Boston, and Mayor Michelle Wu, our mayor, has two really important priorities for the city. One is climate, and one is young children. So I run the first Office of Early Childhood in the city. And so we were sitting around and thinking about how we do something at the intersection of these two priorities. And we happen to be in the same place as the Harvard Center for the Developing Child. So we got together with them to think about how we take the priorities of our administration, which have really been, from a climate perspective, focused on decarbonization of buildings, electrification of cars. So sort of really high level strategies that are important, but for an end user like Sam, maybe not as transferable. So we worked with the center to come up with a 3-part roundtable series, really focused on looking at what's the problem with heat and early childhood, and particularly infants and pregnant people, because a lot of our environmental folks really think about older adults when they think about heat and being fragile or vulnerable. They don't tend to think about pregnant people or infants and toddlers, even though the science that Dr. Burghardt gave us earlier really indicates that they are at great risk. So we did a couple of hours the first day together. We brought together our Department of Public Health, our environment people, some pediatricians from Children's Hospital, some families. So we worked with East Boston Social Center to make sure we really included that family voice in our conversation. And then the policy team from the city. So we all spent some time learning about what we thought we knew a little more deeply. And we got some really great feedback from families that the products that we had produced for heat, some of those cooling towels and the emergency alert system, they didn't really know about. We hadn't done a good job communicating with them about both the challenge as well as what some of the immediate interventions might be. So that was our takeaway from our time together the first day. The second time we met, we learned from other cities. So much like we're doing here today and learning from experts, we brought in some folks from across the country who were working either from an environmental perspective or from a early childhood perspective and a family perspective on the issue. And then the last day that we met, we really talked about what were we going to do with what we learned moving forward, and how were we going to address both the short and long-term needs that we found. And so we settled on 3 areas of focus. One was for some people who don't have a cool home and who may or may not work, what's that third space where they could go for cooling that would be tailored to the needs of our pregnant people and young children? So really thinking about maybe libraries or community centers. The second was really thinking about our facilities. So where our early childhood programs are located, are those in heat zones or heat islands? Are they equipped with air conditioning? So really thought about how we might learn about that. And then the last was working with our pediatricians from Children's who are part of that communication network statewide. What are the messages that we should be sending, both to other pediatricians to share with families, but perhaps with families directly? So we came up with our 3 working groups. We asked them to define what they were going to work on, to think about the strategies that they wanted to employ. We really thought about who's going to be responsible for moving this work forward, because without a leader in each of those areas, we didn't think it would go anywhere. And how were we going to connect to other city initiatives? I think the thing that we learned the most as we were looking at the work was that we really wanted to incorporate an early childhood lens into the work that was already happening. So we have a climate action plan. Is there a piece that's specifically about early childhood? There wasn't, but there will be when they publish it next time. And then in our spaces, our community centers are our spaces where people go to cool, but they aren't programmed. You go and you sit in the lobby. And so we're working with our community partners. East Boston Social Center is one of them, to really bring in the family partners to program the space. And they're bringing a made-to-play kit. So it's a developmental do-it-yourself toy builder that tells you how to use the toys you create. So parents can come in with their young children, they can create something together in the space, and then they have a book to go home with them that they can use when they're at home to make their own toys. And they're all out of things that you would have laying around the house. Sort of get to that perspective that Sam shared around maybe not knowing what to do when you're inside with your small child all day. So that's really what we're doing in the third space area. In terms of our family childcare providers, we're doing 2 things. One is we're connecting them to our Mass Save program, which is our retrofit program. So if you're a homeowner, you can go through the program and get heat pumps and other things at discounted or free. And so working with them, with our family childcare providers, specifically those who are in heat islands. The second thing we're doing is piloting some action research. We're going to give 20 family childcare providers a heat sensor so that they can take time during the summer and see, do they hit that threshold heat indoors before we declare a heat emergency? We think a lot of them will, much like schools. And then have an action plan for following up. And then lastly, we're really working with our Office of Emergency Management and our other city providers to ensure that all the things that go out include those messages about infants not sweating, about needing extra formula and water, thinking about all of the different things that are really particular to pregnant people, infants, and toddlers. And then working with our local community-based organizations as heat champions who are going to help us amplify those messages. So that's really the story of Boston. We're a story in the making, but happy to be here and share with you all.
Hey, thank you so much, Kristin. You essentially showed us how Boston's local leadership is coming together in a cross-sector fashion, and how that's making a real difference. So we really appreciate your fresh ideas today. And I think one of the things I took away from what you just talked about is just the importance of not only innovating and creating and listening to families, but then being able to communicate whatever actions you've taken so that the end user actually knows how to use it. So thank you for drilling down on that. I'm going to turn it over to Michelle, who is now going to take us through the Q&A segment of our conversation. Michelle?
Okay, so we asked you all if you had questions about this topic when you registered, and yes, you did. And so we are now going to take an opportunity to ask some of those questions to our tremendous presenters who are with us today. So I'm going to ask my first question of Sam. So if we can get Sam up on the screen, that would be awesome. Sam, so you mentioned like needing more information when your child was struggling with this heat, and you were seeing these symptoms that clearly were related to his being hot. What kind of information would have helped you from either the early childhood center or from your city that would have helped you sort of deal with this proactively, perhaps, instead of having to be so reactive?
Yes, thank you. I think, like I mentioned before, if there's like workshop or there's one pager poster that we can see from every, nonprofit organizations, community centers, and pediatrician's office, or from school, and distribute from the school, and then can take it home. I mean, I'm very fortunate. I live in Boston, and like Kristin was mentioned before, and I'm so honored and so glad that I'm in one of the workshop. And so, like being said, there are like a third space that's everything is there is being processed and it's ongoing. And I'm one of the members in the third space workshop, and which is wonderful because it covers so much different areas that you're giving out the communication, giving out the information, and then you have the third space ready for the families.
Great.
Yeah.
Thank you. Yeah, sort of one pagers are really helpful in just understanding what the risks are and what we can do to prevent them. And we can sort of digest a one pager versus a multi-page report,
Yes.
Which are needed.
Also, the other thing would be if there's with the different languages would be huge helpful as well.
Yes.
Thank you.
Yes, interpreting and translating those messages as well. Yes, I don't want to tell Dr. Kelly and Dr. Burghardt that the research and the papers that they are publishing aren't important, but for us lay people, having those web pages is really helpful. So one more question for you, Sam, just very quickly, so we can make sure we hear from all of our presenters. Besides cooling centers, are there other supports that you wish your community had or you wish other communities had, especially for those families who do not have air conditioning or cannot afford to have air conditioning?
I think the cooling fan or like a misting fan that can be, distribute free or discounted prices, and mesh breathable cooling mattress pad for the kids. Or like I mentioned about the cooling breathable pads for the stroller, I think is extremely helpful for the young children. Or cooling towels, like which is already been distributed, it's huge helpful.
Right. Yeah, we often know that there are communities who give brand new car seats to families who have a newborn, and maybe we need to think about some of these
Exactly. Yes.
other resources because of the extreme heat issue. So thank you, Sam, so much. I'm now going to turn it to Dr. Burghardt, and you've heard Sam's personal experience, and I just would like to know a little bit about how widespread you see these kinds of symptoms showing up, and particularly for our youngest babies in under-resourced communities.
I can only speak to my own practice, which is small and in the South Shore of Boston. I think that we're starting to understand kind of on a widespread level how the way that children show up and how often actually is really, like we talked about, shaped by where they live. And so for the community where I live, there's a higher prevalence of tree canopy. I would say there's fewer children coming into my clinic, but colleagues who take care of patients in a different office only a few miles away, I think have a very different experience. And so it speaks to how even within the same geographic area, the rates can be really different. I think also one interesting thing in the medical space is that we're probably right now really underestimating the number of children whose problems actually are because of heat, but maybe we're not making that connection. So people are coming in with flare-ups of their asthma or their eczema or their allergies, and we're treating those kids that are in front of us, but I don't know how much as a medical, world, we're kind of saying, oh, this was an extreme heat day, or it was very, very hot 2 days ago, and this child has been sick for 2 days. And when children go to emergency rooms even and have these diagnoses of asthma flare-ups, I think making the connection of warming as sort of the underlying cause is a space that we have to grow as a profession. And part of that, I think, is our obligation to make the connections with families too. And Sam and I have talked about this kind of understanding as a mother that yes, this is a risk to my child and a risk to me if I'm pregnant, and what that means and what people can do to sort of alter their behavior whenever possible, or to seek out the resources like the ones that Kristin and Kelly talked about, to keep their kids safe when it's cool. I think making these connections for people is a place that we can do maybe a service in clinic that will help protect kids.
Yeah, it just speaks to me in terms of it's a cross-sector approach, right? We've got to be talking to people that maybe we don't know. We've got to be talking to pediatricians and early childhood infant and toddlers. Teachers need to maybe be talking to the parents who are pregnant about extreme heat and what can happen, and having those resources or having that information available, just so that we have sort of a multi-pronged approach, just as Boston is doing into dealing with extreme heat. So I just have one more question for you, and then I'll take you off the hotspot. We have a broad scope of people on the webinar here. And I'm just wondering if you had sort of one message that you would like for them to take away from today's webinar, with all the information that's been shared, what would it be?
I actually think, it's less advice and more like a call to action. I think that because we do come from so many different spaces, the more people that can actually articulate the connection between early childhood and climate change, or early childhood and heat, it is so powerful in terms of a ripple effect. Because I think for many of us, even myself, I didn't always connect these two issues in my brain. But once you see how they intersect, it actually starts to feel very obvious. And then you can see all these other connections, oh, wildfire smoke, or you start to understand how really the places where children live affect their development because of these exposures. And so I think that we all sit in different opportunities for intervention. So there's not a great one size fits all, we should all go out and do this. But the more people that we talk to about this work, that we name the importance of this work. My children's school loves when I go in and say oh, how's it coming on our heat action plan? The more times we can sort of raise the issue, I think the better.
Great. Thank you. Yes, it's all about raising awareness has got to be the first step, right? That people need to understand the importance. And Gazi, I know, I'm sure you saw the question in the chat. Did you want to take that on as we move forward?
Yeah, I'd love to pick up from here. I'm thinking about the very last comment that's in the chat box, or at least from what I can see. So our participant, Michelle Jackson, was just commenting that to Dr. Burghardt's point, that she is focusing on heat and warming in her area. And I'm not sure where Michelle Jackson is from, but and that was very assumptive of me. I don't know if Michelle identifies as a woman, and I used she as a pronoun. So my apologies. But Michelle commented that for the program that Michelle's running, that a focus on heat is a priority, and that hydration is one of the things that they're focusing on there. And it just made me think about your talk, Dr. Turner, about heating and how you've been studying this in schools. For those audience members who work directly in early childhood programs, whether it's a family child care home or whether it's a center-based child care program, and perhaps they don't have a huge budget in their program, but they do want to make outdoor spaces safer this summer. So like, in addition to making sure that children are hydrated, what are some of the simple changes they can consider right now? Like one tangible thing you can think of.
Well, I think the most tangible thing they could do is invest in some sort of large umbrella or canopy. So, I mean, when we think about things like schools, we're talking about big things like tree planting programs, and that's definitely an expensive thing that wouldn't be feasible for a family daycare, like a home daycare center. But putting out a tarp is just as effective at cooling a child as a tree. And so I think that would be what I would look to. And then the thing that costs no money is just understanding the signs of heat stress and bringing kids inside. It can be a cumulative effect. So, if a kid's thirsty, they're already dehydrated. If they're starting to feel headachy, they already have heat strokes. So just earlier kind of action.
Thank you so much for that. That's very concrete. You also talked about equity gaps in safe play environments. Do you have any examples that you can share with us in terms of a community that is starting to close the gap in a meaningful way, and what can we learn from them?
Well, I think one of the things that drives the gap is the fact that a lot of our funding for this kind of these kind of interventions are grant based, and one of the problems is that going after grants actually takes capacity as well. And so I think one of the models that I've seen is really successful. I'm in California, so we're in kind of a privileged place that our government has invested quite a bit in capacity building. So we have programs that are just targeted at supporting grant writing and capacity building in communities so that they can actually get the hard infrastructure. However, we are in a difficult moment because a lot of those supports that were there in the first place are going away. And I think a lot of communities are uncertain about those kind of sources. But one of the things that I've seen that's really successful are communities that really leveraged public health networks from the COVID experience. And those are the exact same kind of health, kind of community networks that can be leveraged for something like heat.
Thank you so much for that. Really, that really helps us think more broadly around ways to build capacity. I want to turn to Kristin McSwain and just to kind of ask some questions here. So Kristin, you gave us a really great overview of Boston's work. So for cities and counties listening today that might not have the same resources as Boston, can you talk about one first step you think that could help gain some traction on this issue? And I guess the other part of what I would pose is, if they didn't have a big budget, but they wanted to get started, they meaning a city or a county, do you have any suggestions?
Well, so I would start by saying I think all told we've spent less than $5,000. So
All right.
none of what we did to date has cost money, except for maybe some coffee and donuts for our meetings that we held together. But, you know, part of facilitating just even the infrastructure in cities that you already have. So you've got an office of emergency management or someone who fills that function. You've got a Department of Public Health or some equivalent of that, right? And so, how can you bring them together? Lindsey's research is on the web. You could access it. Most communities have a hospital. And so, I think just beginning to get people to realize that there is this impact on young children. I think a lot of people really don't, particularly our environmental people, because they really are focused on people who are working outdoors. They're focused on elders. They're not really thinking about children. And so there was a lot of aha moments just in our first conversation when people were like, I didn't realize that. So that initial convening of people, I think is super important and, you know, cost the room and maybe some donuts, and some good facilitation. So I think that that is a place to start, and to figure out what resources you do have.
Thank you for that. And thank you for the myth busting, because I do think that maybe it could feel like a non-starter if one is in a decision-making role like this to perceive that this is a terribly expensive initiative to take on. So that's very helpful. And, in your earlier remarks, you touched a bit on how community voice has shaped Boston's strategies. Again, another strategy that doesn't cost zillions of dollars. So can you share a specific example of how a parent or a community member helped shift the city's thinking about heat in families, just to help center how important community voice is?
So I think I can give 3 examples from our meeting. The first was when sort of one of our folks was going through the slides of all the things that they've been doing. So they gave away air conditioners, they gave away fans, because Boston is built for cold. We are not built for heat. So not everybody has air conditioning. I don't have air conditioning. And so I think that those kinds of giveaways, there were a lot of people who were in the room who were like, wait a minute, when did you do that? Like, who did you give those to? And so there was this disconnect between the activities that had already happened and people who live in a heat island, which is one of our target communities, right? It might have been different and received differently if we had brought someone who wasn't in one of our target communities, but this was parents from one of the communities that we had been targeting, and somehow our messages had not been getting to them. So I think that was the first thing that sort of made people rethink how we interact and engage with residents, particularly on this issue. And so I think that's why one of our pillars is really communication. The second one was around the cooling spaces. So a lot of us, we had seen the alerts that say, go to the cooling center. And what we heard from our families was that they were not terribly convenient, both because they didn't have any activities, but because on a really hot day, getting there was also part of the challenge. And so we've been thinking more about how we have misting tents closer together so that you don't have to travel so far in order to have access. And then the third thing was really thinking about, in the long term, a lot of this work is community work. And sometimes we talk about connecting with organizations, but how are we actually going to be connecting with families and listening to families long term, which is why they are also part of our ongoing working groups. So that is a piece of what we have done moving forward that maybe we might not have done otherwise. We do tend to include a lot of families and and community members in all of our working groups, but we were very clear that that was the direction we needed to go and that we needed to make sure that in all of those groups there was someone who represented community.
Thank you. And just building on your point about community, and I know you were speaking about community voice, I just want to highlight and lift up Lana Frisbee's comment in the chat that speaks to community foundations also being a great resource to find grant funding. And so in your recent remarks, Kristin, you talked about all the different partners you have at the table. And it sounds like this is one more example of a great partner that could be at the table helping you think through some potential solutions for this issue. This has just been a really great discussion for me, and I feel like I've learned so much. So I really want to thank all of you, amazing speakers, for your expertise. You're very smart and very passionate about the work you do, and it shows. And we appreciate your sharing real world solutions that's given us a lot to think about and to take back to our own work. I agree with Kimberly, very thought provoking. So grateful for your time and energy that you shared with us today. And I want to thank you, the participants, for sending us your great questions and for joining us. And, you know, it's helped us to really advance this idea, especially since we're heading into summer right now. So we hope everyone is leaving with fresh new ideas and new connections and renewed energy to help keep pushing this important work forward. Before we go, if you could just take us to our next slide, Jonathan or Ingrid. So here are our presenters and their contact information. You will get a copy of today's presentation emailed to you in a few days. We do also want to make sure that you remember the upcoming conversation. So please save the dates for June 5th, July 10th, August 7th, September 11th, and October 9th for our upcoming webinars. So June and July's webinar will be a two-part discussion. In June, we'll be looking at the topic of homelessness. And then in July, we are going to have a focused conversation on housing stability and looking more narrowly at that segment of homelessness. So thank you for being a part of our conversation today. We do want to ask you kindly to fill out the survey that pops up after the webinar is over. So thank you all so much and hope you have a great rest of your afternoon or morning, wherever you might be. And thank you, Michelle.
Thank you for spending time with us today. We really appreciate it. Have a good rest of your day.